Okay, that's great. So press record and let's start off. So we've got a couple of students joining in. Thank you so much for joining the session today. As you know, my name is Raman Singh, and I'm going to be looking at taking you through Learning Outcome 4 today of the unit that we've been studying for the last couple of weeks, which is, principles of safeguarding in health and social care. Just wanted to make sure before we start, if you could give me a thumbs up on if you're able to see my screen and obviously hear me clearly, then we are on our way and we'll do a bit of recap on what we discussed last time, which is on Learning Outcome 3, and then we'll crack on with Learning Outcome 4. I hope everyone is able to hear me and also able to see the screen. Brilliant. I've got somebody. That's great. Thank you. Thank you for confirming that. Now, what we are looking at doing today is we are looking at covering Learning Outcome 4. But before we go into Learning Outcome 4, which is the last learning outcome of this unit, let's look at doing a brief recap in terms of what we've studied so far in the safeguarding unit. So if you recall, what we've been looking at studying in this unit is the importance of safeguarding. Why is safeguarding important, and why is it most important in the context of health and social care? So when we look at the concept of safeguarding, what we are essentially looking at is the aspect of how we protect people, children, adults, vulnerable adults, and ensure that when they are receiving care or any sort of let's say services in terms of healthcare, mental health care, public health care, or in terms of clinical healthcare, then we are ensuring that they are protected from abuse, neglect, and exploitation in all contexts. So when we look at the concept of safeguarding, we basically look at this being a part of the Care Act of 2014. And 2014 Care Act made significant changes to why we need to look at taking action to protect individuals, especially children and vulnerable adults, from harm, abuse, neglect, or exploitation. Now, in this unit, we've been also looking at identifying and responding to various risks and concerns that can be, put into the context of safeguarding. So here, when we look at, risk and concerns, what we are looking at is understanding how do we prevent, what are the measures that we take into account to prevent harm, and obviously how do we address some of these issues, which are issues of abuse, neglect, and exploitation. So safeguarding involves a range of different actions which can be done at different levels and by different agencies. So we see, involvement of, local agencies. We see involvement of councils. We see this being put into as an act and legislation by the government. And then there are risk assessments which are done to ensure we have created safe environments. And there are also, policies and procedures put in place to be able to report concerns to relevant authorities, and thereby the relevant people working within these roles and responsibilities are able to provide support to individuals who are experiencing or who have experienced harm or abuse. Now, it is very important for us to also understand that it is the responsibility of not just the individual, but also of various organizations involved at national, local, and regional level to have and to make sure that their staff or people involved in this process of providing services to the member of public in terms of healthcare services are absolutely trained and up to date on safeguarding measures, and how do we look at protecting individuals or low populations in an area to ensure that they are able to not only identify but also respond to risks and concerns, and then they are able to put measures in place by invoking relevant authorities to ensure safety and well-being of those who are in care. Now, this is what we have been looking into in this unit. Now, if we go into specific details, we have understood in Learning Outcome 1 things like what are the various types of abuses, things like bullying, financial abuse, institutional abuse, emotional abuse, sexual abuse, self-neglect. So we looked at a lot of different types of abuses in Learning Outcome 1. We also identified what are the symptoms and how do we identify these abuses. Now, in Learning Outcome 2, we went into studying understanding of how do we take action if we suspect and see that an abuse is happening, or we see, observe, or suspect, and there are concerns that abuse is happening. So we looked at those 5 videos from Haringey Council, where in each of these videos highlighted different real-time situations, and that helped us understand the role of practitioners and agencies involved in how they can do their work effectively when we look at the process of safeguarding. In the last week's learning outcome, which is learning outcome 3, we looked at identifying specifically the legislation, various acts which are introduced over the years: Mental Healthcare Act, the Care Act, Safeguarding Act, the Equalities Act, the Discrimination Act. We looked at some of these various acts which are directly introduced by the government as legislation. These acts are then being looked at and studied to create policies and procedures which are then implemented in various organizations in various places. And these policies and procedures which are then implemented in various places are then essentially used to create what are called and implement what are called safeguarding and safeguarding areas related to safeguarding policy. Now, safeguarding policy, we also discuss contextual safeguarding, how this is evolving with the rise of social media and online grooming and things like that. So that was the aspect of how safeguarding is keeping pace with the changes in technology. And we looked at a small video of contextual safeguarding in the last learning outcome. We also understood how the policy is to be followed at the national, regional, and local level, and how these policies impact in meeting the requirements, help the organizations, adapt to meeting the requirements of, safeguarding. So one of the things that we saw in video last week was a consultant talking about, a patient which was being put to systematic abuse. And this was a real-time situation way back in the 90s or early 2000s when this, when the act of safeguarding was not even present, and how he used whistleblowing as a process to explain, raise concerns with relevant authorities. And later on, the doctor and the consultant was struck off the Journal Medical Register. So we look at how and what role does or do various practitioners play in ensuring that safeguarding is implemented within an organization. Now, in today's learning outcome, we are focused on understanding, aspects of how do we understand ways to minimize possibility of abuse, right? So this is the main overarching theme of the learning outcome. And here, when we talk about this in this context, there are 2 assessment criteria that we will be looking at. One is explaining how the likelihood of abuse can be reduced in the health and social care setting. And the second assessment criteria is going to be, analyzing the impact of accessible complaint procedure, which can help reduce incidents of abuse. So carrying on with the theme of starting with understanding what constitutes abuse, looking at abuse, neglect, exploitation, and harm. We went into signs and symptoms. Then we went into what actions can be taken by various practitioners, local authorities, national, government. And then we identified the policies and legislations and procedures which are required to be implemented within organization to ensure that safeguarding as a process is implemented thoroughly within an organization, within an institution which is providing care. And in the last learning outcome, we are going to be looking at understanding how do we look at reducing the likelihood of abuse which can happen in a health and social care setting, in a setup like a care home, hospital, A&E, surgery, community center, pharmacies, or any other place which is providing care to the patients. And how do we look at reducing this after our, understanding of what is abuse, what is the policy around it, what role of the practitioner and the authorities and the government, and then looking at how do we then work together to reduce this when we know in an organization the policies are implemented, the people have been trained, the care is being provided, but how do we look at reducing that or minimizing the abuse which can happen in a particular setup? So in order to do so, the first thing that you would see in an organization would be that there has to be a policy on safeguarding. Policy on safeguarding is nothing but a policy statement. That means a statement which the organization has, which basically declares in a way saying that we will look at ensuring protection of child, vulnerable adults, people who are actually receiving care within a particular setup. And this is the organizational commitment to protecting people from harm, abuse, and neglect. Now, if we need to put this into a context in terms of what is safeguarding, one of the best ways to look at this would be to go in and check out one of our policies on our website. If you go to UK Versity's website, and if you go into the footer section, what you're going to be able to see, or in your Moodle, when you log in, you're going to be able to see a safeguarding policy, which will primarily ensure that if, even in the case of teaching as a setup, as an institution, when we look at the process of teaching and learning, we need to ensure that learners who are studying with us are not put into any harm's way through through any abuse, exploitation, or neglect. And this is something which is a part and parcel of, what is called the, let's say the safeguarding, policy and principles within an organization. So this is something which is, addressed at the highest level. And the reason of addressing this at the highest level is to ensure that, we, as an organization, declare that there are going to be suitable measures which are going to be put in place. And these suitable measures which are being put into place are a commitment, or as a statement, are a commitment from the organization to say that no individuals would be put into harm's way or would be abused from the aspect of, looking at, either, let's say being exploited, or in some cases being neglected or abused, in terms of ensuring that their safety is more or less guaranteed. Now, this particular policy that we look at and then we talk about is something which is mandatory in most organizations. And here, if I just bring this policy up for the purposes of just to put it into context, because we are looking at how do we minimize. One of the things that we will look at minimizing harm, abuse, neglect, or exploitation would be to fully implement a policy within the organization or within a setup. And this policy is nothing but a statement from the organization showing commitment that there are relevant measures put in place to ensure that the provider is committed to safeguarding learners and staff from any sort of abuse, exploitation, neglect, or harm which can be done in any way, shape, or possible. It could be bullying, emotional abuse, financial abuse. It could be neglect. It could be physical abuse, psychological abuse, sexual abuse. So all these bits are underwritten as a policy statement within the organization. So the scope of the policy has to be explained, and obviously in relation to the CARE Act of 2014 or 2004, which was then finally, changed, or when amendments come out in 2014, what are the key principles? What does the policy state? So in this case, the government policy on safeguarding has been adapted by the Department of Education, DFE, and they have issued guidelines in terms of in teaching institutions. How does this need to be maintained and implemented is a guidance given by them. And then using that guidance, we have created our policy, which meets the requirements of safeguarding within a teaching institution. And in this case, if there are instances of any abuse which is happening, then we need to be informing, say, Manchester Safeguarding Board, as we talked about the SABs, which have been formed because of the policy in regional levels to implement and monitor safeguarding procedures. One of the agencies which look at, monitoring this is the safeguarding boards. And these boards have a combination, if you remember, they have representation from the local police, the local authorities, the care providers, and the main legislation or the body from the government point of view who form up this board, and their responsibility is to monitor, review, and ensure that safeguarding is a policy, and as a policy is implemented, the principles of this policy are implemented within the organization. So there is monitoring, there are risk assessments which are done, there is communication which is done, there is training which is done, and then supporting documentation is available so that if on request it is asked for, then it is provided by the safeguarding officer, which is responsible for implementation and update and upkeeping of this policy, and obviously details of who to be invoked or who has to be, intimated if this abuse or, say, for example, signs of abuse or, neglect or harm are being detected, then who needs to be informed and what is the decision and what is the process way going forward is clearly documented in this particular policy. So every organization will need to have it, and this policy then becomes the central foundation of how safeguarding is used to minimize the possibility of abuse within an organization. So this policy is something that most of you should be able to access, from within your course. And this would mean that if you need to refer to something which is, if you don't have access to, for example, a policy, essentially, then you would be able to refer to what we have provided. And that should be, used as a bit of a reading point and a reference to understand this in a bit more detail. Now, last thing which I want to look at is, before we get into assessment criteria, I want to look at playing a small video, which is a video which talks about adult safeguarding and what are the possibilities that we can use to actually minimize abuse, which is the overarching theme of today's learning outcome. So let me play this video. And what we will do is watch this short video to understand how does an organization look at promoting safeguarding and the process of safeguarding by implementing this policy, within their setup. So let me share that video. So here we go. Let's listen into this video and understand how safeguarding is put into place, which is basically showing adult safeguarding and how the policy can help if you're worried or if you feel that you are at risk of being at risk of experiencing abuse, neglect, or harm. And this video will basically show the process of how you would need to raise the alarm. And let's listen in.
Every adult has the right to be and feel safe. But sometimes people may experience harm, abuse, or neglect. We can all play a part in keeping adults safe, whether this is happening to us or
someone else. Are you worried about something that's happening to you or to someone you know? Keeping adults safe is everyone's business. It's a team effort, working with the person in the centre being supported to work out what's important to them. Harm, abuse, or neglect can happen to anyone. It can be caused by people we know or by complete strangers. It can happen at home or away from home. What is harm, abuse, or neglect? It could be hurting someone, such as hitting, pushing, or locking someone in a room. Bullying, name-calling, or humiliating someone. Being touched when you don't want to be, or forced to take part in a sexual act. Taking, misusing, or keeping someone's money. Not providing the food, care, or medicine they need. Treating someone badly because of their age, gender, sexual orientation, physical disability, learning disability, or religious beliefs. When someone is neglecting their own needs. We need to work together and report any concerns. If you're worried about your own or someone else's well-being or safety, you can help by acting now. If you have concerns about someone, speak to them. If something's not right, tell them you want to help. They may want to talk to someone about what is happening to them, or they may want you to speak to someone on their behalf. Here's what to do. If there is immediate danger, or if you think a crime has been committed, call 999. If the concern is less urgent, call your local safeguarding team. They will ask you about the situation and why you're worried. Try to give as much information as possible. Information will be shared with others only when necessary. For example, if a crime has happened, we may need to tell the police. Your concerns will be looked into and taken seriously. We will work with the person to help keep them safe. We'll listen and involve them, giving them control and choice over what happens next. If you have concerns, tell somebody. You will be listened to, and help is available. Safeguarding is everyone's business. We all have a part to play in keeping adults safe. Thank you for playing yours.
So as you can see, this particular short video explains, what is safeguarding specifically in the context of adults and what we need to be able to do in terms of, implementing safeguarding. And we basically, kind of go back to the 6 principles of safeguarding that we have discussed, essentially, which have to be, understood and which have to be adhered to so that you are able to, invoke these principles and using them ensure that, the care being delivered is meeting the requirements as set in the guidelines, but also at the same time ensuring that the likelihood of abuse is reduced. So safeguarding principles, which were embedded in the Care Act of 2014, are these 6 principles that we have discussed in the first learning outcome, which is empowerment, protection, prevention, proportionality, partnership, and accountability. So everyone has a role to play in ensuring saving of adults, vulnerable adults, children, anybody which can be put in harm's way. And in this case, these principles would allow us to clearly understand that this is our responsibility collectively as a responsibility of the members of public, and everyone is involved in safeguarding, and it's everyone's business. So if some, say for example, if the friends and families say that, I'm not interested or I'm not bothered because the local authorities are taking care, then obviously in this case, you're shrugging your responsibility in ensuring that any sort of negligence or abuse is detected very early, in the very early stages, than the individual actually experiencing harm and neglect or abuse at the start. So here there is, clear relation to the right to live safely, to live free from abuse, harm, and neglect. And this is what is guaranteed by, observing and implementing the policy of safeguarding, in which basically everyone has a responsibility to collectively work together, understanding these 6 principles, their responsibility to be able to report any concerns, and also keeping the person at the heart of, the concerns which are being raised, so that at some stage, relevant people, or when I say, you might not be authorized to basically take action, as the video said. In some cases, if an offense is being taken place and, it is an offense which needs to be prosecuted, so you will have police which will get involved. If it is, if you go back to the videos that we have looked at earlier from Harringay Council, you would generally see if it is related to children, then you would need to inform the social workers. If it is related to adults, essentially people who are receiving elderly care in a care home, then obviously it will be social workers, or and in some cases, if people are being neglected, say for example, women being neglected or being forced, then in this case, healthcare visitors would need to get involved along with other senior people within the authorities to ensure that, this harm or this abuse could be, minimized. Now, if we get into some of the clear assessment areas, now at this stage, before we get into the assessment areas, I would like to ask, are there any questions, any queries at this stage? on what we've looked at in terms of the overarching understanding of the learning outcome, which is to understand ways to minimize likelihood of abuse or likelihood of harm being done to people who are vulnerable under the Safeguarding Act. Okay, if there are no questions, let's proceed into the assessment criteria. So the first one talks about explaining the likelihood of abuse, which can and how it can be reduced in a health and social care setting. So here, let's assume a health and social care setting, which is looking at, a care home, an adult or an adult care home, specifically where people, older people or retired people are actually receiving care or, essentially living. Now, here the likelihood of abuse can be reduced by looking at what could be the measures which could be put into place by the management and the staff who are running the care home. So we need to think of basic things which are going to be involved in ensuring that risk is identified and the chances of any sort of abuse, whether it's from neglect, harm, exploitation, is reduced or minimized by observing these, let's say, principles which are related to, safeguarding policy. So, and we have to look at all the context. It can't be just one area. You have to look at all the areas. So first area that we will start with is people who work within the care home, staff who give and provide services to the elderly in the care home. What we will need to ensure when the recruitment and selection is being done, we need to ensure that a relevant DBS check or data barring checks, using the data barring service, DBS, relevant checks are carried out and individuals who are recruited are, properly vetted to ensure that there are no previous judgments or any issues related to, causing harm or essentially, ensuring that they have, proper vetting, which is done. So any idea in terms of why DBS checks are carried out? So when we look at, DBS checks.
What did you say, Rama?
Yeah, go on.
What did you say? I didn't hear that question.
Okay, so for the main point of ensuring how do we minimize risk? We look at all the aspects of, minimizing risk within a care home. So first and foremost is we look at resources, human resources, people who work within the care home, who take care of the elderly and obviously provide all the care services. So why are the DBS checks carried out on people when they are being recruited to work within a care home?
Is to know. Is to know if they have any criminal offense
case.
Also, yeah,
that is correct. Yes. Go on.
Someone that has a criminal case, it might be another danger to or risk to the organization. So they have to carry out the DBS check.
That is correct. So there are various reasons why a DBS check or a data disclosure and barring service, DBS stands for disclosure and barring service. Now, these checks are carried out by a government agency, which is responsible for processing criminal records. And they are used, these checks are basically checks done, as you rightly said, to check on any sort of, basically a background check on any sort of criminal record for individuals who are seeking to work with vulnerable group of people or children or adults. And this is where it needs to be, carried out. So these checks ensure that employers actually are recruiting people who are going to be able to provide a safe, work in a safe environment, and they have no previous background of any sort of criminal history or record in terms of working in these public or public places or public organizations in which care is being provided to vulnerable adults, children, or in this case anybody who is receiving care like the elderly. Now, the requirement of DBS checks is to ensure that it is carried out for all staff, any sort of contractors or people who work on contracts or part-time, workers. volunteers which are essentially working within a care home, and these people have not been barred from working with groups because of when I say groups, I mean vulnerable groups or people which will cover adult children, and they have not been barred from working with these groups due to their criminal convictions or past criminal convictions. And the information which is then coming out of this check, which is done, allows the employer to recruit the person or the staff confidently to say that, yes, they will be, able to, let's say, offer them a role and a contract, and they would be good employees working and observing safeguarding principles given the training, and they should be able to then, work within a health and social care setting. So this will be the first thing that you will do. Now, if you look at organizational's perspective is going to be that the care home has robust policies and procedures in place. That means they have a safeguarding policy. The staff is adequately trained. The management is aware of the organizational commitment which is required when the safeguarding policy is published. Also, if there are changes to law and legislation which happen over a point in time, then the management, or in this case, the registered manager, compliances or quality manager, whosoever is the manager in this setup, is then also keeping and updating the policies and requirements with the changing laws which are introduced, or changing regulation which is introduced from time to time. And this approach of training and development and ensuring that policies and procedures are in place to implement the various, let's say, techniques and policies which will ensure that, there is nobody being put to any sort of risk, or if there are people being put at risk, then it is easily identifiable by members of staff who work and provide daily care to the elderly. Now, when we look at staff training and development, there is obviously training and development that you need to do so that you understand what is safeguarding, you understand the principles of safeguarding, you understand what is your role in observing and helping to deliver safeguarding practices within an organization. And the skill and the knowledge that you gain from this training will allow you to detect any sort of abuse or harm which is being carried out, and then you are able to alert relevant people or your manager, so that appropriate action can be taken on time to prevent this particular abuse or harm being done to an elderly within a care home. Obviously, the point related to strong leadership and management, because if the management's commitment is not there to ensure that safeguarding is implemented, and they do not put various best practices in place and ensure that there is somebody at the end of the day who is responsible for making sure that the compliance is there in the organization, then the organization is leaving itself, and the members within the organization are leaving themselves exposed to abuse and harm or neglect taking place in their organization. You would generally see within various setups and various places, including care homes, there are effective communication and information, sharing, which is done in order to prevent this particular, when I say in order to prevent any sort of harm happening within the premises. Now, this is done through information boards. You would see normally notice boards at various places, like at the reception, like at the entrance of the office, or within the organization on the walls, in kitchens, in obviously common areas within a care home. Lots of posters, communications being put across, and that is basically nothing but sharing of information and ensuring that all people understand what is required to be done in order to ensure that people are safe within the premises when they are receiving care. Now, this information can also be shared through newsletters, through emails, through regular announcements within the organization. And all this keeps the members, staffs, contractors, volunteers, people who are working and providing this care to the elderly, just making sure that the information is at the top of their mind. If you're alerted and this is constantly being, discussed, talked about, then this is not something that you can forget. And you always are keen then to look at implementing this within the role and responsibility that you carry out within the care home. So you would normally go in and see if there is any sort of, signs of a neglect or any issues that you see which are being observed. Obviously, in some of these places, you would see that there is CCTV monitoring installed, but that is more for the purposes of monitoring. But the process of communication, open channels of communication between staff, various employees, contractors, part-time workers, volunteers, ensures that everybody is kept, updated with regards to any changes or any, relevant information with regards to spotting, any abuse or neglect which is being carried out or is being meted out to a member of staff or, the elderly people within a care home. Now, one of the other things that because we are talking about a setting of an example of a care home, one of the main things that we have to look at in mind is that health and social care workers should also be aware of that the key concept of providing care within the NHS, National Health Service, care homes, and any sort of care settings that we look at is the focus is on person-centered care. So when we look at Carl Rogers and the concept when he introduced it in the late 1960s, we look at the concept of what is called the person-centered approach. And this is something which means that, care is being provided to the person, according to the wishes and obviously requirements of that individual. That means the approach to providing any sort of service within the care home would be prioritized and would be looking at individuals' rights, responsibilities in terms of preferences, and choices which the individual would make. And this care then is being provided with dignity. Information is being provided to the individual to ensure that they are able to make independent decision, which is autonomy, and then making sure that when we provide this care by taking these 6 principles of person-centered approach into account, then the care is helping the patient to get better, or is helping the person live a safe and healthy life, or has a safe and healthy lifestyle within the care home. Even though the elderly, they have full freedom and all the rights being provided, and they are not being put in the harm's way. And this approach of person-centered care is a holistic approach to care, taking into account the physical, emotional, social, and spiritual needs of the individual who's receiving care within the elderly home or care home, in this case, the elderly people. So the 6 principles of, person-centered care also are important to be practiced and observed while providing this care. And they are also ensuring that any sort of risk, or abuse, there is minimizing of any sort of risk or abuse being carried out to the elderly within the care home. So when we look at these approaches, how do we look at minimizing these approaches? We are looking at recruitment and selection process to be robust. We are looking at policies and procedures to be implemented within the organization. We are looking at training and development. We are looking at commitment from the management to ensure that they are not going to leave any stone unturned in order to ensure safeguarding for people which are in the care home. In this case, the example that we are taking is elderly people in the care home. And then there is an open channel of communication which ensures that information is shared, and then the care being carried out or provided to the elderly, in this case in the care home, is focused on person-centered care approach, which helps to improve patient satisfaction, health outcomes, and the quality of life which the elderly people are enjoying and living and taking care of within the care home. And this is very important to ensure that abuse is minimized, or the possibility of abuse is minimized within a particular setup. Is that okay? Is that clear?
Yes.
Okay. Now let's look at the second assessment criteria, which talks about analyzing the impact of accessible complaint procedure and how this can be used, to minimize incidents of abuse. Now, if I look at a practical situation, why do you make a complaint? Why do you have a complaints policy in an organization? When you go to Amazon or when you go to Argos or you go to any place and you buy a particular product and you feel that you have not been provided proper service, or if you feel the product is not meeting the quality standards, what you normally say is that I would like to meet a manager. I would like to meet the manager and make a complaint. So why do organizations have a complaint policy? The reason why organizations have a complaint policy, why do you think, before I answer this, let me ask you this question. Why do you think, organizations have a complaint policy?
I think because if you live, just as you said, like Amazon product and other stuff, maybe if you buy a product and the product is not good, you need to make a complaint of that product. I don't know if
That's
it's
correct.
right, but that's what I think.
Yeah, that is correct. So anybody else would like to have a go at it? Why do we see, or why do we have a complaints policy or a procedure within an organization or any particular setup?
Yeah, with the complaint, I believe that the company meeting the needs of the person, or it will make the company more organized. Yeah, it will help the company grow because they are meeting people's complaints, something like that. Yeah.
Yeah, that is also partly correct what you've said. So anybody else? All right. So what some of you have said is, correct in one way or the other. Basically, if you look at a complaints policy, is a policy which helps you meet and put a check to what you're saying in terms of services or product quality, or what you're selling as a service or providing as a service to the customer is concerned. So literally outside the remit of this unit, but if we look at literally a complaints policy is is put into place to allow a structured and a transparent process for individuals who are buying the products and services from the company to be able to raise concerns, right? Or a concern. One is you raise a concern, and if the concerns are not being effectively met or answered, it is not answering if I raise a concern that this product is, if I buy something from, say, Sainsbury, and I say, okay, this product is expired and should not be on the shelf, you raise a concern first. And if the concern is addressed and they say, okay, we do apologize, and, we will replace this product for a like-for-like product. Now, if they address that, acknowledge it, your concern is taken care of. But if the concern is not acknowledged and not taken care of, then you need to fall back on what is called a complaints policy. And the policy would lay out a procedure of how you would go about making a complaint, because it is not meeting the criteria for which you are actually you're paying for that. So if you buy something, say, worth £100 from the store, and if it doesn't conform to the quality and, the expectation that is being given in the manual, then you will raise a concern. If the concern is not addressed by relevant authorities, then you raise a complaint. And that complaint would then be looking into, resolving your concern by a relevant person or a person with authority within that organization. So complaint policies are put in place to address one part, which some of you have rightly said, address concerns and resolve issues. It is also looking at the second point which somebody made is, it is also looking at when you say improving service delivery. So you're looking at improvements, and that is where some of these, complaints and concerns which are raised would allow you to look at, raising it with relevant people. And when they look into it in detail, go into the depths of it in terms of why this has happened, then it helps them improve delivery. Or in this case, maybe providing service when we are talking about care home. Now, if we feel that the beds and mattresses within a care home, have been not been changed, or if the linen is dirty and it's not being properly, sent to laundry and it is not being done regularly, then the people who are living, the elderly people can raise a complaint to say that my beds and linen are not changed and on a weekly basis as described in the policy of the arrangements which have been agreed to when I became a member of the care home in terms of receiving these services. Now, if it happens as a one-off because of maybe strikes or because of some issues or problems, then that is okay. But if it happens regularly, then somebody would not raise a concern, but actually will raise a complaint with the manager. And if it is still not resolved, then you will basically take action against to ensure that, what is being committed as a service level agreement is being adhered to and is being provided, because you're paying for those in terms of costs, to receive those services. Now, complaints procedures are also put in place to sometimes look at building trust and confidence with, customers or consumers. In the case of care home, this is a compliance that they will need to be put into place, because if, this complaints procedure is not there, then it does not, help build confidence with the service level agreement, or the agreements which are put in place or agreed with the patient or elderly who is moving into the care home and is paying for those services. So in order to build trust and confidence, you would also see that complaints policies and procedures are made and obviously made available within organizations. So in this case, a care home, and if there are concerns, then the elderly can raise them to be addressed with relevant authorities, maybe the manager or the management, and this is likely to put more confidence and faith within the organization and how it delivers the services. Now, complaint procedures are also required because it's a legal requirement. So in some places, when services are being provided and you're paying for those services, it also can be a legal requirement to have a complaints policy in place. Some organizations have complaints and compliments policy. That means you can also compliment them if they are providing you service over and above the threshold or the standards which have been agreed in the service level agreement. But generally speaking, a complaints procedure is also a legal requirement because every organization in the care sector needs to have a policy as per the government requirements. And this is to ensure that, there are ways and means in which consumers, people who are receiving care, can actually raise concerns or issues through the complaints procedure, and thereby it will help authorities to carry out risk assessments and relook at the procedures which are implemented to avoid individuals, being put into harm's way or being abused. So, rightly said, when we look at analysis, we will have to give a lot of different types of arguments to explain how an accessible complaints procedure can help in reducing complaints or abuse. And in this case, we have discussed a couple of points which are generic, but when we apply it to a care home, because we are looking at a health and social care setting, they would be points like addressing concerns and resolving issues. They will also mean improving service delivery, looking at meeting the service level agreements which have been agreed with the elderly before they move into a care home. It will help in building trust and confidence with the elderly in particular, because this would ensure that they can fall back onto a procedure if they feel services are not being provided in the fashion or in the manner which has been agreed on in the service level agreement. And last but not the least, you're looking at ensuring that the legal requirements are from the government or relevant authorities, in this case the Department of Health, mandates that the complaints procedure needs to be there, because it mandates it as a legal requirement that organizations need to have a complaint policy in place. And this complaint policy will particularly be, in the case true for healthcare providers and organizations which basically deal and provide services to vulnerable populations. Is that okay? So these are bits that we would need to discuss. And how do we look at reducing the complaints coming across is going back to the points wherein the care staff or people who are involved in providing care are absolutely aware of the complaints procedure. So it creates a bit of a fear, but also creates a positive fear in the context of ensuring that they need to adhere to some of these policies so that complaints are not raised, so that service standards are met. So the other side of the coin is it also looks at because if there is a complaints procedure, it also instills fear within the within the workers or within the staff to say that if I don't perform my duty or my responsibility properly, then a complaint can be raised against me, and that could lead to review. It could lead to some sort of dismissal in certain extreme cases, or it could lead for me to be put into training and development because I'm not aware or I'm being insensitive to the process of how I am delivering care to the elderly within the care home. So in this case, you need to be able to, I would say, take an example towards the end by putting these arguments forward to say that a complaints procedure ensures and addresses concerns and helps in resolving issues. And if there is a complaint which is not being addressed within the organization, then a third party or an independent adjudicator also needs to be present to be able to resolve that complaint. So in care homes, for example, if complaint and complaint procedures are not resolved, you would generally see that it is a compliance related matter, that there should be an independent adjudicator also mentioned in the complaints policy. Now, again, when I mention this to you, you can fall back and look at, the complaints policy that we have within the organization. And that complaints policy essentially looks at, ensuring that you have a fallback in case if you feel that, these services are not being adequately delivered or, adequately provided within the teaching institution. Just as an example, a case in point. So we have this misconduct and appeals procedure or a policy, which is essentially a complaints procedure. And this is again a mandatory. When I said a legal requirement, it is a legal requirement for most organizations in the teaching sector, in the public services sector, in the care sector, in the National Health Service or health and social care sector, to have a complaints policy in place. So the complaints policy will also say, you have first level of complaint, then it is looked at by somebody else, the second level. And at the third level, you would need to have an independent adjudicator, which is somebody who's outside the organization, if a complaint is not resolved in time, or if the complaint outcome of that resolution you are not satisfied with, then the complaint procedure or the policy will also highlight very clearly who is the independent adjudicator that you can go to. So in most cases, within the health and social care sector, it tends to be a legal authority or a body like CQC, the Public Health England, or, in some cases, local authorities, would be defined as, independent adjudicators. So in this case, the safeguarding boards would be, in some cases, the organizations would put safeguarding boards in the local area as the independent adjudicator if the complaint being raised is not adequately met and, say, for example, dealt with in time, then the patient, or in this case, the elderly person, can go across to the independent adjudicator to say that my complaint or my concern has not been addressed. And I would like to, I have no faith within the organization because it could be because they feel it is biased or it is not being dealt with properly. In those cases, you could basically go in and also, complain to the third party. And in this case, it is specified within the complaints procedure. So is that okay? Any questions on today's discussion? Any questions now? So this brings us to the end of Learning Outcome 4, which helps us understand how do we minimize the risk or possibility of abuse within an organization. And we have looked at this being done through the route of implementing policies and also ensuring that we are able to understand the safeguarding principles and then implement them, rigorously within the organization. Now, if you want to read further to be able to understand how this, learning outcome, for this particular learning outcome, how do we minimize the possibility of abuse, there is a particular link which I put in here, which is an evaluation of safeguarding child assessment and analysis framework called the SAF, which has been introduced by the government. And this particular document would help you understand how we can minimize, the risk to abuse within a particular, setup. So if I open this up and show this to you very briefly, this is a handout that I would suggest that you read for some additional knowledge. And I would put it this way, that this would help you understand, this particular learning outcome in a bit more detail. Now, in some cases, this learning outcome is also related to the fact that we need to understand safeguarding principles and the implementation of these principles, clearly within a particular setup. So you'll have to look at an example of a care home or any particular health and social care setup. It could be a pharmacy, it could be a community center, it could be a hospital, it could be an A&E, but choose a setup which is something that you can identify with. And towards the end, because the analysis requires you to take an example, that would be helpful. Now, what we will also do is let this document load. My internet is slightly slow. It's not a very heavy document. But what we will also look at is, for tomorrow's session, we are going to be looking at, discussing the assignment brief, which is primarily going to be bringing this unit to a close. So let me just quickly refresh this. And what I would want to do is discuss the assignment brief in tomorrow's session, and that would, essentially help us complete this particular unit. So when we look at the assignment brief, there is a case study which is given, and there are some tasks associated with the case studies. So this is what we are going to discuss tomorrow in obviously our session. So if you think of any questions, you can write to me on the email and we can discuss that tomorrow. But what I'm also going to be able to do is basically provide a bit of a sampler in terms of how do we go about doing the assignment, because this is a graded unit. The word count is 3,500 words, and we need to be able to address some of the bits which have been covered in the case study and use this to contextualize and then cover some of the tasks which are required in the assignment. And that will be a discussion for tomorrow. So this is the framework document which is there. It's a very big document. I don't want you to go through this in a bit, all the details, but yeah, some relevant sections in terms of how do we ensure that, safeguarding is, how do we ensure the risk is minimized by implementing the safeguarding policy within an organization. There are some, bullet points that you can read in this particular document, and that would be useful. So that will be useful because they would be useful from a point of view of understanding how it is implemented from a legislation perspective. And this document then becomes a foundation document for most organizations to look at, structuring their policy and procedures and its implementation within the organization. This is an output of a research report which has been carried out, by the government, and obviously they published this particular report. So it's a detailed report, but leaving just the introduction part of it, if you want to read, that would help you understand, the reasons why safeguarding is important and why this framework was put into place in the first instance. So a couple of pages at the start would be good enough, for the purposes of detailed reading and getting a bit more knowledge on today's learning outcome. So thank you so much for attending. Any questions at this stage, feel free to ask me now through the chat route, or you can unmute your microphones and ask me. Otherwise, we'll be seeing each other tomorrow to discuss the assignment discussion.
Arama, sorry, there is a question I want to ask, but I know